But the first question I'd like to ask is, I've got two questions here from Adrian Brink, and I think that they're really important for the overall kind of discussion in this webinar, really, and they're about language. And this is something I know that's been very important to a lot of the work that we've done. So Adrian asked this question: has anyone studied alternatives to the term resistance? We've done some qualitative research in different public settings in South Africa and published as such. It is clear that the term resistance is problematic. Now, I know had a lot of discussion around the use of antimicrobial resistance and antimicrobials and all this kind of stuff when we've been trying to kind of understand and come to a collective shared understanding of the vocabulary that we need to use in order to undertake community engagement in all the settings that we were working. So I just wondered, has anybody from the panelists got any reflections on that, on the question of language and the use of the term resistance, and whether that's been seen as problematic in the work that we've done? I don't know who wants to go first. Rebecca, you've just come off mute. Do you want to go first?
Well, I was going to say, I mentioned in the chat that I completely agree with the observation. And it's certainly something that we see constantly, this idea of people seeing themselves as becoming resistant rather than the bacteria. And particularly around this topic of the translation and the use of the concept, I was going to request my colleagues Rumana and Abriti to comment on that, because we've had extensive discussions on the challenges of translating these concepts into kind of locally understandable terminology. So perhaps Abriti or Rumana would like to give some more detail on that.
Thank you. Shall I just chip in? Yeah, thanks. So as Dr. Rebecca mentioned, that it was really difficult for us to find a term in our local language, that is Bangla. And we had to use multiple sentences or explanation to convey the message at what does it mean. Even as I was saying that the policymakers at the senior levels, there are differences in understanding of antimicrobial resistance, antibiotic resistance for human health, environment. So I agree that it is not very easy to convey the message and get the term, but definitely we need to discuss with wider stakeholders that what is the best way to communicate, and maybe in our upcoming research through these we can also understand in a better way that how to communicate and get the appropriate wording to reflect the true spirit or the message of antibiotic resistance or antimicrobial resistance.
Abriti, do you want to comment?
Yeah, I mean, like, I think it's similar what just Dr. Rumana talked about, but yeah, we do have a technical word for antimicrobial resistance in Nepali as well, but then like probably even I might have not known or would not have understood it if I were not into this, working in this sector. So it is actually difficult to translate it in a language that community people and stakeholders can understand. We will need to use, we actually need longer sentences and statements to make it understand. And on top of that, it gets confusing with the medicines and the antimicrobials. So people, when we have a context where people consider antimicrobials also as antimicrobials as just medicines, and find it very difficult to differentiate between antimicrobials and medicines. So in that context, it is more difficult and challenging to translate it to a local terminology and also aware people on these topics. Yeah, thanks.
Great, thanks very much. So the next question is in the Q&A, and it's directed at Rumana, but I think it would be helpful for both of you to respond to this. This is on the identification of stakeholders, and this is from Roderick. I would like you to shed more light on the strategies that you use to identify stakeholders that were genuinely willing to be part of the project. So clearly you've already pointed out who you need, how you go about engaging stakeholders, particularly policy stakeholders. But I wonder if you could say a little bit more about how you go about identifying this. And then also, I think if you could maybe reflect on what is in it for policy stakeholders. Why would policy stakeholders want to engage with community stakeholders? Why are they interested in being part of this dialogue?
Thank you. So First, we tried to identify the stakeholders by level, that who are at the central level and who are at the local level, at district or sub-district level. And then in the central level, we had to find out the entry point through the line ministries who were working on antibiotic resistance or antibacterial resistance, including Ministry of Health, Agriculture, Environment, Disaster Management. So a number of ministries. And then from there, we got some sort of snowballing that who else are working in there. And from there, each ministry also has a list of their stakeholders. We try to combine all of these, and we try to create an influence matrix, as I was saying, that who does work and who has what resources available and their current way of working in the context of AMR. And the local level, the same. We started with the Ministry of Local Government, and then from there, with the Ministry of Health support, we identified other people. And also there are a community clinic, as I was saying, the lowest service provision center in Bangladesh. And through the community clinics and other health centers, we also try to find out that who else are working in those areas, including the non-government organizations and others who works on the AMR. So there are gatekeepers and some local elites at the local level and some ministries at the central level, to which we really identified other key stakeholders from their experience. There are some networks also, antibiotic or antibacterial resistance network. So and professional bodies, as I was mentioning. So we also contacted them, and through these professional bodies, we identified more stakeholders. And in our research, we arranged some stakeholder consultation event where we also got some suggestions. So at different stages of the research over the cycle, we kept on compiling all this information, and finally we came up with a matrix where we have all the stakeholders by type of stakeholders, by level, and their resource and interest and work area. Thanks, I'll stop there.
Riti?
Yeah, I think that the process that we apply for stakeholder identification is quite similar to what just has been mentioned. So I will not repeat all those. And yeah, it is. And we also have, and in the context of Nepal, we also have a National Technical Working Group for AMR. So that was initial as an entry point for identifying the stakeholders, and also by first trying to understand what other sectors do we actually want to include when we are saying AMR, because it's not just health, it's also animal and environment, and also a bit of agriculture and others. So we did it that way. And to your other question, Paul, on why would a stakeholder want to engage with communities, or so I would say, I mean, like with my experience, it was not easy enough to convince stakeholders on community engagement, because like it's not something that we have been using very widely. To some stakeholders, it's fairly a new concept, and in the beginning, like saying like community would be engaged and they would be working on it and filming and everything, we had to answer a lot of queries and questions. But at the end, I think they did understand, and they did understood the power of community engagement and what that led to, and how it has been impacted, how it has shown its impact throughout the even after the end of the project is very important. And probably by now, at least the stakeholders we have engaged with would understand the importance of community engagement and would feel like they would want to do it again. Thanks, Paul.
Great, thanks very much. We've got another 10 minutes, so I'll keep going with some more questions. Again, this question is directed at Rumana, but I think both of you can answer this. It's about community dialogues. So it's from Deborah. I find community dialogues to be more effective in rural settings than urban settings. What is your experience? Any thoughts of effective approaches across these two settings? Now, Briti, I'm not sure that you guys have done community dialogues yet, but you might be able to kind of relate that to your broader experience of participatory practices, you know, which obviously you've done an awful lot of. So Rumana, do you want to take that first?
Okay, thanks. This is a very good question, and fully agree, because in Bangladesh, the rural areas or rural health is covered by Ministry of Health, and there is a structure of health service delivery, which can be used as an entry point to engage the community. And at the same time, people have less movement in the rural areas, and it is really easy to identify them and arrange or contact them on a regular basis, given their less mobility. As opposed to that, in urban areas where there are lots or different types of people who some are floating, and it is very difficult to engage with them in a formal way or formal setup. And also in the urban areas, it is under the Ministry of Local Government. So the system and structure is different, and the people dynamics and their socioeconomic status are different in urban and rural areas. So I fully agree that it is the approach that worked in rural areas may not apply in urban areas, given the diversity of the population who work in urban areas, and most in the informal setting, and some floating population without proper address and lack of way of tracking them. But definitely we have to find out some innovative ways of how to engage them through the existing system, which is in a limited scale functional in urban areas through local government. There are opportunities, but needs to
it looks like
more
we've lost
on that. Thanks.
Thanks, Ramana. Sorry, we lost you just at the end there, but I think we got your main message there. Abriti.
Yeah, just to add on, like I would probably that's what I believe is like contextually tailoring of whatever we are doing, depending on the context and the place we are, where we are planning to actually implement the community dialogue. So yes, it might not be appropriate, one approach might not fit all, and we will probably need to adapt the community dialogue approach based on the stakeholder, based on the context, community context, and implement it. Otherwise, it is going to be difficult in one context and easier in the other, and vice versa. So probably adapting and locally tailoring is a key when we are doing any community engagement activities. Yeah, so yeah, that's all.
Rebecca, is there anything that you'd like to add?
No, thank you. I think it's been well responded to.
Great. So another question that I think is certainly been important in the work that I've been involved with CE for AMR. This comes from anonymous attendee. Often engaging community and multidisciplines, we face resistance from the system itself, e.g. contemporary beliefs, leaders, even authorities and experts. How have you guys managed that? How have you guys engaged with, I suppose, either skepticism or knowledge that we know is not necessarily compatible with received best practice in terms of dealing with AMR? So whilst we have, in terms of community engagement, we talk about equitable partnerships, we try to kind of understand and value the knowledge of everybody that's involved. Clearly, some stakeholders have more knowledge in some areas than others, and there can be tensions between these different forms of knowledge. So I wonder how has your work kind of tried to negotiate this? So, for example, how have you attempted to negotiate traditional beliefs about AMR versus the World Health Organization's guidelines or whatever it might be? I don't know. So, Abriti, do you want to have a go at that?
Yeah, it's not yes, I have been also mentioning in my presentation, it's people and the stakeholders do not understand, they do not have a similar understanding, and there is a difference in their understanding. Yeah, it is a difficult task. I think it's all about keep on trying, explaining what it is and why it is important, because there is very less limited understanding on how they are interlinked and what impact actually it can bring. And the most importantly, bringing all the stakeholders from a multi-sectoral perspective in one platform is again another challenge, and discussing on it is again another one. So we do have a policy, we do have actions, we do have guidelines, but then implementing it and making stakeholders understand of the concept is again is a tricky part, but it's like just we keep on trying and explaining and bringing the factual evidence, I mean the contextual evidence, and showing how it is impacting rather than something that's beyond something from broader, from let's say from outer perspective. So community context or from showing the evidence is something that would probably help, maybe.
Mana?
Yes, thank you. I think from our experience, I agree with the points that Abriti mentioned, but just to add on that, for the facilitators who were responsible for engaging with the community, it is really critical to develop their capacity so that they can make a balance when people just engage, and they have to create a platform so that everybody's voice is raised. And when we gather these community people, balance is also very important because then the actual interest of the engagement is lost. I don't know if am I audible. So those who are arranging and facilitating that, I think lots depends on their expertise and capability. And the last point is that the commitment, political commitment from the government is really critical. So we need to have the buy-in from the government at different stages so that they can work as an anchor and create a platform of engaging all. And we need to ensure the leadership and governance within the system so that it works and it sustains. Thank you.
Thanks very much. So I think we've probably come to the end of the Q&A now, but there's one question in the chat that I feel obliged to answer, and I'll answer this myself. And it is the question, where can we find the films that have been produced? And I can't find out who asked that question now. So apologies for not naming you, but thanks very much for that question. So all the films that have been produced from the Karen project, which is one of the projects that Abriti mentioned, can be found on the CE for AMR website, where lots of other resources can also be found, not least the resource that Rebecca introduced today. And that will also be where we will host lots of other films that we are currently producing across both Bangladesh and Nepal. And I'm very excited to see how those films start to emerge and what we learn from those films, and lots of the issues that have been discussed today. You know, we see them in the films themselves that emerge from these projects. So without further ado, thank you so much, everybody. Thanks for our fantastic speakers.